All right. Are we about ready, or you want to wait a few more minutes?
I am ready whenever you are.
Okay. All right. Well, welcome. We should anticipate a few other folks joining us, but we're going to go ahead and get started. It's a few minutes after 3, and want to make sure that we respect each other's time. So thank you for joining us today. You are at the right workshop if you're wanting to come and learn about what social workers do during this crisis and beyond. My name is Jennifer Jewell, and I am co-presenting with my co-host,
Kalila Collins. Hello, everybody.
And we'll introduce ourselves a little more as we, in a few minutes, but we want to first start with looking at it, at the agenda and what we plan to cover today. And so just a little housekeeping. As you all know, this is, Zoom is kind of our life now. And so a couple of just housekeeping tips is that you're going to stay on mute at this point, depending on how many people join us. We might do most of the conversation via chat. If it gets too big, it's really hard to really have a conversation when there's too many people. And so we're going to keep you all on mute at this point, but please use the chat box. And we really want to encourage you as you're going along, if you have questions, if you want to make a comment, please use the chat box. We will be monitoring the chat box and we'll respond as we move along. We are recording this so that we can share it with others who can't be with us today. So if you don't wish to be recorded, we encourage you to leave the meeting because we will record in order to share this with others. Unfortunately, what we have to say is if you are disruptive, you will be removed promptly. Also, in kind of today's world, the Zoom bombing is a real problem. And so if anyone becomes disruptive, we will remove them from the presentation. Matt is with the Poor People's Army. So if you see you can see, if you in the chat box, you can look for Poor People's Army. If anything comes up and you've got a technical question or something like that, you can reach out to the Poor People's Army, and Matt will help you. So those are the first housekeeping items. We will, and so please use the chat box as you're going along. So we're going to do introductions just so that you all know who we are, and we're going to get to know you all just a little bit here in a few minutes. We're going to talk about radical social work. What is radical social work and what does it mean? We're going to talk about COVID-19 and special populations. We're highlighting just a couple of special populations, but as social workers, we know that there's a lot of various oppressed and marginalized groups that are disproportionately impacted by COVID-19 and other crises. We're going to talk about radical imagination, what that is, how do we use it, and what does that mean in creating a new world, and how do social workers have this radical imagination in which we can use to create the world that we want to see. And so I want to thank you all for joining us, and we're going to do quick introductions. And so we'll start with Kalila.
Good afternoon, everyone. Again, my name is Kalila Collins. I am really honored to be here with you all today to have this discussion. A little bit of a background about me. I'm currently the Executive Director for Making Connections New Orleans, which works towards better mental health and well-being outcomes for African American men and boys in the New Orleans area. A little bit of my history. My history is steeped in economic human rights organizing, anti-racism organizing, Black Lives Matter. I couldn't even reproductive health organizing. I've been around for, I'm not gonna say how many years doing this work. Came into social work as a result of this work. And the two, the organizing and the social work kind of ran hand in hand with me. So that's how I ended up here with you all today. Did I leave anything out, Jennifer?
You left a whole lot out, but
Oh.
I'll let it slide.
Okay.
So my name is Jennifer Jewell. I'm the Interim Director of the School of Social Work at Salisbury University. And I guess probably what the biggest part that Kalila left out is Kalila and I actually came into community organizing probably about the same time, or I came in just a little bit before her. And really it started as around welfare rights organizing. Kalila and I were living in a transitional housing facility for homeless mothers going to college. And so we had started an organization, a poor people's organization. And so a lot of my organizing actually came out of doing human rights organizing, economic human rights organizing. And it was really organizing what brought me to social work, because what I found out is I was doing social work, right? So didn't think of, I had my own personal social worker, my own case manager, my own social worker in the transitional housing facility, but I didn't realize the other piece of social work was this community organizing piece. And so once I found that out, I ended up going into getting my master's and my PhD really with a focus on community organizing. And so Kalila and I did a lot of organizing for probably a good decade or more with a group that we helped to start called Women in Transition in Kentucky. And so that's really kind of how I came to social work, really was from organizing. And so that's when we talk about these ideas today around a radical imagination, that really was sparked because of the grassroots organizing that we did early on in our lives. So I'm excited to be here with you all today to continue talking about these, well, I shouldn't be excited to talk about these same issues that we've been talking about for a very long time. But I'm excited to be here with you all to talk about these issues with more social workers, because they are pertinent to social work, yet we don't always get this type of education when we're going through getting our bachelor's or our master's, that this radical education is something that we need in social work and we don't always get. So I'd like to know a little bit about who is joining us here today. And so Matt is going to launch a couple of polls. And so here you go. So who are you? Are you social worker, social work student, an educator, a friend of social work, or other? Tell us where you're coming from. What part of the US are you coming from, or out of the country? And then also, what type of area of social work or what kind of work are you doing? And please use the chat to tell us more. You can tell us what city you're coming from, what country. You can tell us what kind of work you're doing, that kind of thing. Please use the chat. Wow.
No, this is exciting.
I know, I like seeing these pieces. So we've got about 70% of people who have voted. So go ahead and get your votes in there. Or I guess not your votes, but your answers.
Where's my folks from the South? We got to represent. Where we at?
Yes, Joe, it's working. Oh, a school social work from West Philly. All right. Becca Brown, she's from Salisbury. Nice to see you. Oh, we got one person from the South, but I think that's Tia, isn't it?
Is Tia here?
I think she is.
Yep, I see her.
All right, Portland State University. Okay.
All right.
Got someone all the way on the west. South Africa. All right.
Wow.
We saw you, Bruce, Reverend Bruce. We saw you coming in. All right. So, so about 50% of us, UNR, okay. Are you one of Mary Hilton's students from UNR? So most of us are social work. Yes, good. Mary said that she was going to share this with some folks over at UNR. So most of us are social workers. We have a good contingent of social work students and educators, and then a few folks that are in other professions. And so we really are excited for others to be joining us as well. So we have we'll see the Midwest. So Tia must have went with the South versus the Midwest.
Yeah.
We always argue whether Kentucky is the Midwest or the South. So she went with the South on that one.
And outside the
U.S. What did you say?
She knew I was lonely down here by myself.
She wanted to make sure there was a southern vote, but mostly from the East Coast. So that's going to be a good contingent from Oregon too. Welcome, Dara. And so we got a couple of people from the West Coast. We saw Portland, a couple folks from, and then Nevada. And then let's see, in terms of the areas we work in, so a good contingent of working with unhoused people with housing insecurity, child welfare. Child welfare obviously is a big area within social work, and mental health, and then education and schools. And so that's a good one. Yeah, and so Reverend Wright was talking about, especially in Florida and Tennessee, working with homeless and addicts. So that's those are some of the major areas that we see in terms of social work practice. All right. Well, welcome, and continue using the chat because we'd like to hear more from you all, because although this is KHALILAH and I are going to be talking a lot, we definitely want to hear from you all as well, because although we have a lot of knowledge, you all bring a wealth of knowledge and practice experience and personal experience. And so we'd like to hear that from you all as well. And so please use that chat to as we're going along. So, radical social work. You want to take this, KHALILAH?
Sure. So my first thing is, when we hear that term radical social work, and use the chat box, what comes to mind for you? What do you think of? What are some things that you think of when you hear the term radical social work? I'm gonna, just type a quick answer in the chat box for me. Root cause, the anti-war movement. Outside the box. Ooh, pushback against NASW. Okay, that's interesting. Liberatory practices to dismantle oppressive systems. Okay. Not being a gatekeeper, complete overhaul, complete change. These are some really good answers. Maybe you all should be doing this webinar instead of us, huh? These are some good answers.
It's always better together.
Yeah, always. And so I asked that question because for me, Jennifer gave you a little bit of our history together and how we came to this work. But I remember organizing, didn't know what I was doing was called organizing. I knew that people didn't have what they needed, and I felt like it was my responsibility to help people get that. And through that work and through those experiences, I ran into all kind of social workers, dealing with PPERC and different welfare rights organizers across the country. And I remember talking to one in particular, and because in my head, a social worker was that child welfare worker or the food stamp worker. And so when talking with people that I was working with, and they were telling me, well, I'm a social worker. Well, I'm a social worker. And I was like, wait a minute, that's not, I don't understand. And so my introduction into social work in this level, it seemed radical to some, but it made total sense to me, right? Just like the child welfare worker or the person that's helping you get food stamps or housing was helping you get what you needed. The people that I was around on a daily basis was doing the same thing, just on a different level. And so I think oftentimes we hear the term radical and think there's something crazy or outside of what we're supposed to be doing, when in reality, it's exactly what we're all doing anyway, right? And so I think that the term radical has been, has given us like this, negative connotation to what it actually is, but in reality, it is doing exactly what we think social workers do on a daily basis, which is help support people get what they need to thrive and survive, well, to survive and then thrive, right? So go ahead. I'm sorry.
I was just going to jump in there, and I would say too is that when we think about this term radical, just like you were saying, is this, you know, this negative connotation, and we oftentimes, we're not in the U.S., we kind of abandon the use of radical because of the negative connotation, while other countries have embraced the term radical social work. So you can look at some work out of the UK, and they use radical social work, but in the US, you really haven't heard the term of the concept of radical social work for a few decades, and partly because we really have abandoned the term because of the negative connotation. Now, while radical social work didn't actually disappear, we kind of just changed its names, and really it has its roots in this emancipatory social movements, really concerned with the oppression of various groups. And so in the US, we have examples such as, you know, Occupy, you know, a decade or so ago, Occupy Wall Street, to Black Lives Matters, to the Dreamers, to some of the larger movements that we've seen over the last decades, and then the poor people's movement around economic human rights. And so even though we've abandoned the term of radical, that work has still been going on.
Right. And social workers are definitely at the core of a lot of those of all of those movements. And so it's really important that we understand that that we have places in those movements. And so radical simply means grasping things at the roots. I think that somebody said root cause. I think they got a hold of our PowerPoint, Jen. But
early release.
Yes, somebody leaked it. It was leaked. But it's just that, it's doing that grassroots work to in all the words that were said, to dismantle oppressive systems and that kind of thing. And so and to overhaul and change these systems that are not set up to support all of us, but are set to only support a very, very few of us. So.
And I would say too is that oftentimes for us as social workers, that some of the work that we do as radical social workers is what we do on our off time, right? As volunteers or activists outside of our formal social work employment. While that often differentiates radical social work from traditional social work, the real emphasis in radical social work, you know, as Davis says, is really grasping things at the root. And so taking this action of grasping things at the root and really doing something about it. And so that's a key point when we're thinking about radical social work, right? So it's not just about putting the Band-Aids on. It's not about putting the Band-Aids on these issues that we're seeing, but it really is getting at the root causes, such as patriarchy, white supremacy, capitalism, ableism, the isms, right? And so it really is about addressing those key root causes when we're thinking about radical social work. And so that's really the lens in which Kalila and I come from when we're talking about this work. So COVID-19 and special populations. Now we could talk about a lot of different groups here, and so we're just going to highlight a few. But more than any crisis in recent memory, the COVID-19 pandemic highlights the deep structural issues that are pervasive in our U.S. society. Now, a lot of us that are here today are well aware of these pervasive issues. That, you know, this is work that we've been doing for decades, or we've been talking about these issues for decades, right? But because of this pandemic, it has really opened a gaping wound, right? It was already, for many of us, we already knew it was a gaping wound, but it really has opened it, and it particularly has opened the eyes to so many others who were ignoring, not cognizant of the issues of so many vulnerable populations in our society. And we can't effectively, implement social distancing, because even during a pandemic, the needs of capitalism supersede those of actual people. So forcing underpaid workers to put themselves at risk so companies can continue business as usual. And even as we see now, states are just kind of itching. They're ready to, open those doors back up. And so for a lot of folks, the most vulnerable, it is because of needing to feed the machine that we continue to put people at risk, particularly these vulnerable populations, because oftentimes we see these groups, we as in a general we see these groups as expendable. So we're going to go with the question. So I think you want to undo mute.
Yeah,
we're going to undo mute here. So for you all, we're going to talk about a few different special populations. What are you seeing in your community? What are the groups in your community that are being disproportionately impacted by the pandemic? And so,
mute it back.
Oh yeah. So you're gonna be mute. So take yourself on mute and you can answer the question. So what are you seeing in your community about the groups that are being disproportionately impacted by the pandemic? So just unmute yourself to answer.
Well, this is Bruce Wright in Tennessee. Being that we're in a rural community here.
How did he know it?
What's that?
Oh,
We got to.
Hello?
that's such
mute
a
everybody
idea.
and then unmute.
Community and in other rural communities we work with, we're seeing a series
Yeah.
on small farmers, low income.
Oh, babe.
You're cutting in and out, Bruce.
Yeah, someone keeps popping in while I'm talking, so I don't know. In our community, we're seeing disproportionately low income farmers and small farmers impacted, as well as factory workers in our small town, which already has a poverty rate of 50%.
Mm.
So that's what we're seeing.
All right. So disproportionately impacting low-income folks. All right.
Yeah, farmers in particular.
All right.
Small farmers.
Where are you in Tennessee, Bruce?
Lewisburg, it's just south of Nashville. It's called Middle Tennessee,
Oh, okay. Uh-huh.
Alabama border.
All right. Thanks. Who else? Who else are we seeing disproportionately impacted? So Nicole said Walmart workers being hassled to come back to work, and Walmart provides no PPE. All right.
People of color and share people of color.
Uh-huh. Joseph said those without savings. Yeah, so especially in this kind of hits back on what Reverend Bruce was saying is, low income people, and especially if you have no savings and then you're laid off, it's gonna severely impact you.
Yeah, Kendra sharing, people with disabilities are impacted, who they would normally get face-to-face services or therapies or appointments. They're not getting the same level of support and probably treatment in this crisis, in this pandemic.
Yeah, but I think especially for people with disabilities, because some of them are going to be, like OT or other like hands, like you can't do some of those therapies, via telehealth. And so having access to those would be significantly hampered. Now, Quisha said people in prison. Yes, we're going to talk about people in prison here shortly.
Bill shares with us the houseless community. They're not able to, like, we're using this term of shelter in place, and they're not able to shelter in place or have access to hand washings and other resources. Also mimicking kind of what Reverend Bruce said, Bill says, farm workers that are forced to work, threatened with reduced wages. Tia talks about students with accommodations or disabilities not getting their services they need while having to try to navigate school from home.
That's significant. Mondi said government grant receivers, so pensioners, people on welfare, and homeless people. Yeah.
So we all know of and understand that this is disproportionately affecting people. And it's not just about the impact of your physical health, but there are so many other things that are at play as we try to navigate COVID-19.
Yeah, and Battleletto said children and families involved in foster care systems. So thinking about some of my work after I'd finished my master's was in reunification. So think about if that probably for a lot of families who may have been going through the reunification process, they might not even have access to have visitation with their kids right now during this time. And so all the progress that they had made in terms of rebuilding the relationship with their children to hopefully bring them back home, and then for, visits to end, and how significant that can be in terms of building toward a relationship of reunification.
One thing I would add too that is not on this list or on our list we're going to talk about later is, and this can fit into any of those categories, but people who don't have access to technology, right? I think that we're very privileged to be able to host a Zoom call or to talk to our family and friends via Zoom or FaceTime or whatever. And so people who don't necessarily have access to technology to engage with folks are also being impacted.
Mm-hmm. Beth also brings up students in under-resourced schools not getting access to education, equity issues, low-income families not having access to online learning. And so we'll talk about that, and this piggybacks on what Kalila was saying too, is like in some communities, I know in my community, I know in Louisville, where Kalila and I are from, schools provided some type of technology so students could access online learning. Now, whether students have, access to the internet is maybe a different question, but that, in other communities, that probably wasn't the case, that, under-resourced schools like Beth was bringing up may not be able to provide, a tablet or a computer that someone can use while they're at home. So these are definitely major issues. And then also a couple more, the minorities, homeless, people living in nursing homes, and people living in poverty, significant issues. And then also people don't have loved ones or are living alone. And we're not going to talk about that too, but the psychological impact of being isolated and what that can mean for folks who don't have any kind of connection. Maybe, again, they might not have technology, or they just might not have anyone that they can interact with, and how that can impact you mentally is important. And then lastly, Anne brought up group living situations and how significant that can be in terms of issues that people run into. So it's not lost on us. And then Nicole brought up in-house rehab patients who can't find long-term housing after they're released. Yeah, I mean, these issues, the ramifications of this pandemic have been so vast across our society. And as social workers who work with the most vulnerable in our society, we can see, the significant impact that this pandemic has had and will continue to have for quite some time. And so we just want to talk a few minutes about some of the populations. And one of the ones that people have brought up were minorities, people of color. And so we could talk about several different groups in terms of people of color, but we're going to start with African Americans because that's the one that's been largely disproportionately impacted. And then also we've been seeing a lot about this in the news in the most, last couple of weeks. So do you want to start, Kalila?
Yeah. So again, as someone who is currently living in New Orleans right now, and before I came on here, I just talked with a physician at one of the healthcare centers, and we had a long conversation about COVID-19 and some of the impacts. And we didn't talk about this specifically, but we did talk about the medical piece of it and how and why. And so what we're seeing, Louisiana is made up of 32% African American people, but accounts for 70% of the deaths here in the state around COVID-19. And we know since day one, they've been telling us that there are underlying conditions that exacerbate or that could have bad outcomes as a result of it, or that put you at a higher risk for this. But I think that when we talk about that, we talked about, okay, if you have diabetes, if you have some kind of heart condition, then you're at higher risk. But we didn't talk about, if you didn't have access to insurance, or if you didn't have insurance or have access to affordable health care. If you work at a job, which is a lot of jobs here in New Orleans are what the term is gig work. So restaurants and artists and different things who don't necessarily have access to any kind of healthcare benefits across the city and then in the state. And so those are also factors that play a role in why we're seeing these numbers. And me and the doctor today, we kind of joked about, not joked, it wasn't a joke, but, I said things about we say you're at a higher risk if you have underlying conditions, when the underlying condition is racism, right? So all of these are not genetic defects or are not, cannot be, and he did mention this today too, is not contributed to the race of a person, but basically it's contributed to their socioeconomic status in this country. And so I was not surprised to start seeing these numbers come out the way that they did, just based on what we know to be true in this country. And so, yeah, And we're seeing that happen across the board. We've seen it in Chicago, well, in Illinois, we're seeing it in Michigan. We know that environmental racism plays a huge role in this as well. We're seeing it in North Carolina, the numbers are rising. And so all of those environmental factors, living in food deserts, not having access to education, to healthcare and insurance and different things like that, all play a role in our healthcare outcomes, which then play a role in if we have those actual physical underlying conditions that may create a higher risk for us with COVID-19.
Yeah, so when we're talking about, exactly, so when we talk about environmental racism, we're going to talk about food deserts. I mean, the reason why that African Americans have many of these underlying conditions like asthma or diabetes that put you at a higher risk for COVID-19 to be fatal is because of these structural inequalities in terms of race and class that are pervasive within our society. And so a couple of examples, I mean, one that comes, to mind, if I say Flint, Michigan, folks are going to be able to quickly understand about Flint, Michigan, right? And the lead paint. Here in Maryland, where I am, Baltimore has a huge lead paint issue. And so when you think about all of these environmental pieces that impact your health and then make it more susceptible to have worse outcomes if you contract COVID-19. In Kentucky and Louisville, where we're from, also Rubbertown. Rubbertown is where a lot of the synthetic rubber is made. And so folks in that area have higher rates of asthma. And so, when we think about these structural inequalities that are pervasive in our society, then they disproportionately impact people of color when we're thinking about like food deserts and environmental racism. Anne says that rural area hospitals have been purchased by larger hospitals and smaller hospitals closed, so poor and rural people have to travel for service. Yeah, that's a significant issue that we see. And don't have access or don't have like the number of respirators that that they might have had because of they've had to close, or there's just not as many per capita.
Right.
So the other piece to this is an editorial cartoon, but this is, when we talk about essential workers, and if you're on social media, I've seen some memes that go around talking about is, the people who were asking for $15 an hour are now, considered essential employees, right? People working at restaurants, people working at some of, the various big box stores where we have to go get groceries or, things like that. And, when we think about those who work in those areas, whether it's these essential workers that are stocking the grocery stores, or they're working in delivery, or they're working at restaurants, they're disproportionately a lot of them are low income and also people of color, and so they don't have the luxury just to say, okay, I'm going to work from home today, I'm going to distance myself from COVID-19 and I'm going to work from home. That's not an option, right? They have to go to work. They have to make their bills. And so they don't have the luxury of just staying home and working and being safe. They have to be out there in order to make ends meet. And so the next group we just wanted to highlight is Indigenous folks. And so for Indigenous folks, COVID-19 is particularly hitting the Navajo Nation particularly hard. It's in just, I'm going to show you a map here in a minute, but in 24,700 square miles, it's very sparsely populated with only about 175,000 Navajo citizens living in the area of the size of West Virginia. I'll show you a map here in a minute. There are now more than 1,000 cases and more than 40 deaths just in that small area. again, 175,000 Navajo citizens, 1,000 deaths already. The Navajo Nation has more COVID-19 cases than 9 entire states and more deaths than 13 states, according to the chief medical officers of the Navajo area of Indian Health Services. Why is that? It's some of the same issues that we were just talking about in terms of African Americans, in terms of these systemic issues as well. And so one is lack of running water. So 15% of individuals living in the Navajo Nation have no running water. And so it's near impossible. You know, one of the recommendations in terms of avoiding infection is, you know, washing your hands. But with 15% having no running water, it's nearly impossible for people to follow that important recommendation. Also, there's a chronic housing shortage. So half of all homes all homes are housing multiple generations of folks. And then there's just other basic infrastructure issues, such as not having sewer service or electricity or internet. So in a 2018 U.S. congressional report, Indian Health Services, one of the U.S. government's primary funders of tribal water and sanitation systems, said the Navajo Nation had a backlog of 450 million in unfunded requests, right? So again, this neglect, this abandonment of folks, you know, prior to COVID-19, right? So if some of these issues had been addressed, these systemic issues that have been well documented for some time, for decades, had been addressed, we would have been avoiding some of this disproportionate effect on African Americans and indigenous groups now. But yet, here we find ourselves where African Americans are dying at higher percentages across the nation, where we have indigenous folks also facing the same ill effects of COVID-19 because of a neglect and because of just a abandonment of providing what is needed to these folks. So here are just the cases for you all who, actually some of our folks out in the West will know this, but here's where the Navajo Nation is. And you can see this is from about a week ago of these numbers, but you can see here that the numbers are pretty large and, you know, and growing in this area. And as you and Ann had brought up talking about rural area hospitals, it's the same thing. Because this is a rural area and it's sparsely populated, they don't have huge hospitals. And so once they get sick and they cannot be served by the hospital on the reservation, that they're having to be flown out to Albuquerque and other places to get the services that they need. Anything you want to add there, Kalila?
No, I don't have anything. I mean,
All right. So, so individuals who are incarcerated. So Nell had brought up people who are in prison. And so before we get started, I want to show just a clip of let me see. Oh, we're skipping ahead. Sorry. Are you all seeing my internet? Are you all seeing my, okay.
Yep.
All right. So we're just going to show you like 2 minutes of this.
Jail facilities typically hold people who have been arrested and have been charged with a crime but are presumed innocent, but the majority of people are eligible for bail and can return to the community, but they are too poor to pay their bail. So nobody should sit in jail just because they're poor, and especially when there is a pandemic going on.
We just look at it as just looking grim. It's only a matter of time before we all get it.
There is an added touch of desperation to calls coming out of jails and prisons
We just in here, look.
around the country these days.
God just called in, and there's just no way to escape it, bro. So, you know, if this is the last one you see me in, bro, know that I love you. But, you know what I'm saying? Like, I mean, not to sound like that, but it's real.
Confinement and social distancing are mostly incompatible.
Inside of a cell, you have to basically figure out how are you going to adjust, because a few feet down from you is another person.
Caroline Woods is out of prison now, but a couple of years back, he was my guide to prison life at San Quentin, outside San Francisco. You don't have a hell of a lot of room in your place.
You can only, it's like one person can only move at a time. Like if we have to turn sideways. When I say that small space, as you know, you was in there, it's about the size of an average person's bathroom. So that's what that confinement is.
Adnan Khan is also heavy.
So I just wanted to show you all, so you can Google prison videos and COVID-19, because there's a lot of folks that are in prison right now that have been sharing videos from the inside, talking about the issues that are going on for those who are incarcerated. And you can see here, this is a picture from Cook County in Chicago, that you can see that people that are incarcerated in the jail there are saying, help, no supply, no masks, right? And so you heard a couple of different things there. And one is that, you know, folks that are in jail, especially in jail, are often just too poor to get out, right? So, you know, if they had enough money, they could be out and be able to social distance and be in a safer place. But because they're just too poor to get out on bail, they're stuck in the jail. And being poor shouldn't be a death sentence during a pandemic, right? That folks should be able to get out, especially when it's in the issue of just being too poor.
And I just wanted to add that the majority, thinking about, so in jail, yes, bail is an option, but also in our prison system in general, it's poor people and people of color, primarily African Americans, right? So that just goes back to that, you know, two populations back when we're talking about African Americans still disproportionately being impacted by this pandemic.
Yeah, and you could see there too by just, you know, a couple of those clips is that, you know, jails and prisons are just petri dishes. I mean, you cannot social distance anyway in a prison or a jail. And so it's just hard to avoid any kind of infectious disease. And then oftentimes, because jails and prisons try to cut costs, and I'm not going to even talk about for-profit prisons, but because they're trying to cut costs, they don't have the medical supplies necessary to address any kind of outbreak behind the wall. And so they don't have respirators. So if someone was to get deathly ill, they're not going to have, you know, even the basic supplies in order to keep folks safe. And so what we've seen is that there have been some states in which, through advocacy and through grassroots organizing, where officials have really kind of felt the pressure and started to release some individuals who are incarcerated. Yet not enough is being done to protect individuals who are involved in the criminal justice system. And so a couple of areas, so in Pennsylvania, Buck County, and somebody in Pennsylvania is going to help me with this one, Northumberland County, have reduced the jail population by 30%. In New York City's Rikers Island, a judge approved the release of 51 people for alleged parole violations. Now, we know in some other states, like in Maryland, you're not supposed to be arrested for parole violations anymore. So that's a, you know, a larger issue. In Georgia, a judge ordered the release of over 100 people in DeKalb County jail. In California, between 150 and 350 people are being released. In Detroit, 400 people since March 10th. And those are jails, right? Because jails have maybe a little more flexibility to release folks, right? But prisons are a little bit harder to penetrate and have in terms of kind of the movement. But there has been some movement in terms of compassionate release of older incarcerated people, people who are sick and go on home confinement. So, for instance, in Washington Department of Corrections, they were releasing a little over 1,000 people within 48 hours of the announcement back on April 16th. So just within the last few days, they were releasing 1,000 people. And some of it's part of this, you know, folks that, you know, the compassionate release, but also people who have lower level offensive, nonviolent offenders, low risk offenders. And in Pennsylvania on April 10th, Governor Tom Wolf had agreed to temporarily release some from Pennsylvania states who fit the criteria of nonviolent and would be eligible for release within the next 9 months. Now, all of that sounds good, and I was only mentioning a few, you know, a few of the states and a few of the jails and prisons. But when you think about 2.3 million folks in the U.S. are in prison, are in jail, in juvenile facilities, are in immigration detention centers, that's obviously not enough. It's not enough, right? It's not enough to ease the tension within these correctional facilities when a pandemic is coming through. And so as we used to say, it's necessary but insufficient. Necessary but insufficient. And while I commend, you know, these governors and, you know, these other folks for trying to make headway, it's not enough to help save a lot of these individuals that are incarcerated from feeling the effects of COVID-19. And I think the other piece you could add is also, it's not just the folks who are incarcerated, but it's also the folks who work behind the wall. So correctional officers are also being affected at higher rates. There's been several deaths of correctional officers, and then those correctional officers are then also taking it back home, bringing it back out into the community from these areas. So significant issues. Anything else you want to add there, Kalila?
No, I think that this is a good opportunity for us this is a good space for us to think about. I know here in Louisiana, we're looking at larger reform as a response to this. And so as we move on into the presentation, this is a good place for us to make sure we put a pin in to come back to think about what we can do as radical social workers moving forward.
All right, so then the next one is just, and we're gonna go through this one pretty quickly. A
lot of it's been covered by the chat room.
Yeah, because you all, and a lot of you are already working in this area around working with folks who are experiencing housing insecurity. And so I just want to point out a couple of the pictures. And so the pictures are, so the one up here in the corner, the one where it says hotels for unhoused, this is out of California. And then this one right here in front of the Hilton, this one's from out of New Orleans. Both California and also in New Orleans, they're starting to house people in hotels, and so making hotels available for unhoused people. That's important to. So you can see there. So in California, this is important to note. California's Governor Newsom had announced that he was planning to secure 15,000 hotel rooms. Now, this is the same thing I said with the prisons. That's great, But when you have over 100,000 folks who are living on the streets or in cars, 15,000 is just a, you know, a drop in the bucket. But we'll give him a little round of applause for effort. The problem is that there's some communities in California that that not in my backyard, right? NIMBY, right? Not in my backyard, that are not allowing this to happen in their communities. They're saying that's okay for that community, but we don't want homeless folks being housed in hotels in our community. And so even though the governor is pushing to have some of these folks housed in hotels, it's been real difficult for him to secure even the 15,000 because people are like, not in my backyard. What I'll also say is that kind of going back to what Kalila was saying is like these long-term, right? And so Governor Newsom is working with hotel, which hotel is it? Motel 6, I think. Motel 6, and is looking to maybe potentially buy some of those hotels up to provide long-term housing in the future. And so he's kind of looking at a long-term on how to house 108,000 people living on the streets and in their cars in California.
And it's important to note real quick, Jen, I'm sorry to cut you off.
Yeah, go ahead.
It's important to note that the not in my backyard is a real thing, and people who are saying that are very well equipped to use the law to back them up. And so what we're seeing in several places is people are doing things like, you know, zoning infractions, you know, so if it's a hotel, that's fine, your zone is in a hotel. But if you are actually housing people for an unterm amount of time, that means you're now a transitional house, or you're now a, you know, permanent resident, and you're not zoned for that. And so people are able to legally combat people from moving into their neighborhoods or into hotels using things we have in place to use, and using that against us. And so it's important that, sufficient, I mean, not insufficient, needed but insufficient, because yes, we need to house people right now, but we've already created barriers and things in place to keep people in a certain place. And so again, another place to put a pin in later on and think about how we can, you know, go towards change.
Mm-hmm. And so then this one here where you see these boxes on the floor, this is for my Nevada folks. This is Las Vegas. And so after there was a resident who had tested positive for COVID-19 at Catholic Charities was forced to close their housing facility, and so put over 500 individuals out on the street. And so in response, the city of Las Vegas opened an emergency shelter outside. So I don't know what kind of shelter that is, but they opened up a shelter outside on a parking lot. And what they did is they drew boxes on the outline to ensure that people were properly social distancing. And you can see here that, you know, no padding or anything was provided for them. Up here in the corner, this is for my Philly folks. So hand washing stations for those who are outside sleeping rough. So they'd have access to some of the, you know, the hygiene, being able to wash their hands. In some communities, they're also having, you know, setting up mobile, like bathrooms or mobile stations to take showers for folks that are outside. Here, this picture right here where the tents are, this is actually where Salisbury University is, or in Salisbury, where Salisbury University is. And this is their Project Hope, and they're giving out, as you can see here, tents for individual use so that then they're properly distanced from each other. And then lastly here is you have some folks, medical folks going out and trying to test people who are experiencing housing insecurity. And so you can see some of the different ways in which some communities are responding to the need of those who are unhoused. All right, so another world is possible. And so this idea of radical imagination And so, Kalila, I'm gonna let you start on this one.
Oh, where do you want me to start?
Right.
I don't want to. So I think that again we've had some examples, or we scratched the surface on what this other world could. I mean, well, not even we. I think that we are seeing in this time in the last 5 to 6 weeks what that other world could look like. Right? We're seeing that we can give folks the care that they need as far as their physical health is concerned. We're seeing that people, we can send a check to every household and support income. We're seeing that we could potentially house people who don't have housing, right? So we know that another world is possible. It's a matter of who benefits, and it's about what we hold as valuable, right? And so I think that this is where we can start having conversations about what that world could look like in this moment, and what people actually need to make that other world possible, and that it benefits. We're in a point where we can imagine what that world should look like, and then push to make that world better, make that a better world for everybody.
Yeah, and so what we know, right, and so some of those pieces that Kalila brought up, and then even the, going back to those who are incarcerated, like this whole issue around bail, but all of a sudden we can figure out how to let folks out without having cash bail. And so exactly, we are seeing glimpses of this other world that a lot of folks on this call have been working for decades to push for and try to
decades.
Go ahead.
You just keep saying decades. I'm only 12.
All right, it's me and Reverend Bruce then. We've been pushing for decades for this, for these exact things that are starting to come to fruition because of this pandemic. And I'm excited because it's showing people that these things can be done and they should be done. But we're going to have to keep pushing for it once this pandemic is over. So I'm going to let you, this is your thing too.
Yes. So self-care to me, I think that we hear it a lot, and it's been thrown around over the last few years, take care of yourself, take care of yourself. And I am not diminishing that, right? That is super duper important. I think that in order, I actually was gonna put on my t-shirt that existence is resistance, but I took it off because I realized it was a shirt that I had on on the flyer. So I took the shirt off. But I think that we have to understand that in this moment, as we do this work in general, though, we have to be here to do the work, right? So we have to take care of ourselves. And that doesn't just mean, a spa day or whatever. I mean, it could mean those things. I know for me personally, over the last few weeks, I've had some serious ebbs and flows, right? I've had some days when I couldn't get out of bed. And then I've had some days where I couldn't sit still, right? And so we have to understand that taking care of ourselves is also part of taking care of our community, and taking care of each other through this and through the work that we do just in general. And so you may think that not taking care of yourself is not that important, or making sure that you're okay is not important. But again, your existence is resistance, right? And it's a revolutionary act to be able to be here and continue to fight for, to work towards the better world. And so it's also equally important that as we do that we're looking not just towards ourselves, but looking towards community care. And we'll get into a little bit more of that in the next couple of slides. But I think it's really important that we understand that we can do the day-to-day work, and we can have the day-to-day conversations, but we have to make sure that we are doing the best we can to take care of ourselves in order to give our best selves to this work. I'm sorry, my dogs are barking. To do this work and to be able to move forward, because without us being as best we can, we can't do this. And so if you think that taking care of yourself can wait till tomorrow, know that it can't, because you're going to fizzle out and burn before you know it. And again, being radical, being revolutionary includes how you take care of yourself and then how you take care of your community.
So as social workers, you know, we often hear about self-care. It seems like it's definitely the I mean, we've probably all heard it, but it seems like it's extra buzzy-wordy over the last year or so. But self-care as individuals. So what do we think then? What does community self-care mean? What would community self-care look like? And so go ahead and chime in on the Zoom, on the chat. But what does community self-care look like? So you can chime in there, or you can actually even unmute yourself if you want. So mutual aid, good, yep. What else? What does community self-care look like? Zoom support groups, listening, showing up when needed, inclusivity, setting healthy boundaries.
Yeah.
Accountability.
Resource sharing.
Those are right on. And so when we think about community care, some of the first things that social media has helped me stay in touch with others. Yeah. When we think about community self-care, some of the first things that we think about, right, Reverend Bruce, is mutual aid, right? And so mutual aid really is this idea of communities you know, that are really providing relief directly to the people where the government has failed. And so communities take on the responsibility for caring for one another rather than forcing individuals to fend for themselves, right? And this is, you know, going back to this idea of radical social work that we were talking about earlier, right? This kind of flies in the face of capitalism, in the sense of, like, capitalism is just like fend for yourself, we're all in competition, survival of the fittest, right? But in mutual aid, it really is about people coming together, people sharing resources, people taking on the responsibility to care for each other, because my survival is tied with your survival, right? And so mutual aid is really about taking that on together. Go ahead. Were you gonna say something? Okay. So, but what mutual aid is not charity, right? It's not charity. It's where people become where it's not this dependence on this relationship where you're having to negotiate access to material resources. So it's not charity in the sense that now I've got to figure out how, you know, you're going to be, you know, give me something else. But it really is this reciprocal relationship. It's this reciprocal relationship where all people have something to give. All people have material goods or assistance to one another. And so it really is, like like Reverend Wright said, Reverend Bruce said, it really is this, this resource sharing. It's really this resource sharing. And so mutual aid has played an important role in community organizing. You know, thinking back to the 60s and 70s, where you had the Black Panthers breakfast program, or the Young Lords, where they had free health clinics and community testing for tuberculosis and lead poisoning come to mind. But mutual aid is not always looked upon favorably, and Kalila had brought this up earlier, particularly depending on the group. For example, we know in the US that they've now passed laws about against providing food or money to the homeless, right? So, you know, us, you know, trying to care for other folks who are currently unhoused is now against the law for us to give them food or to give them money, right? And so mutual aid is not always looked upon favorably, right? Or even, you know, in California where they're trying to house folks in hotels and people are fighting against it. Some groups, you know, have been providing mutual aid for as long as they've been in existence, because while the needs are great now, during this crisis, the need has always been there. It's not like people were just homeless because of the pandemic. It's not like people are just hungry because of the pandemic. These things have been going on. And so organizations like the Poor People's Economic Human Rights Campaign established what they termed the Underground Railroad, where they would provide, in this reciprocal relationship, provide for the needs of those, whether it's through housing takeovers or right now, even through some of the direct service work that Sherry and her crew are doing in Philly. And so this is a call to Sherry, who's going to talk to us a little bit about what she's doing, what they're doing in Philly right now. Sherry. She's out there doing the work now, so we got to just get her attention. You there? Sherry.
I see her car, so I know she's
she's out there doing the work. That's the.
Did she leave her phone in the car? What is happening? Oh,
She
she
might
raised
have
her hand. She raised her hand.
Do you need us to unmute you? Unmute her. Where is she? Sherry? Can you unmute her?
I just did.
Thank you.
There we go.
I'm going crazy. As long as I've been muted in my life.
Turn your camera around. We're seeing your face.
Oh, you don't see my face?
No.
No, we're seeing a hand maybe.
Oh, goodness. Okay, so I will talk while I try to figure this out. Of course, I had it figured out before I was on here. But thank you for doing this presentation, and I'm so excited to have so many social workers on here. I see some folks from Social Work Action Alliance and some Temple folks and Lori, who we're working with from Temple University right now. And so what we're doing, well, actually what we've been doing for years is when people need housing, we're housing folks. And when people need food, we're feeding them. And when people aren't getting access to medical care, we're figuring that out. We're figuring out all the various different things that are needed using the similar process that you talked about, which was the Black Panther Party or other mutual aid stuff throughout history. And the only difference this time is that it's so massive now. Every day, we're getting up and we're trying to figure out, like, okay, how do we feed all of America? How do we deal with everybody that's having a panic attack with rent coming up, and they have hood landlords, so perhaps they can't participate in just the rental strikes that are taking place because they have a landlord that's going to throw everything out in about 10 minutes. So we've really moved from what we call the nonprofit industrial complex model and see ourselves as more, we're calling ourselves the Poor People's Army, because, you know, it really is a war situation that's happening out here. And so we're trying to learn from peasants that are organizing all over the world. So we're internationalists. And so we're learning about, you know, how to live cooperatively, and really increase our numbers and do all of these things, with, quite frankly, without social media. So we've got people that are volunteering that are literally, you know, in the hood, where a third, you know, like in Philadelphia, a third of the people don't have access to the internet. And so for us, it's necessary to drop flyers door to door. So we're social distancing, but we understand the importance of newspapers like the People's Tribune and the Tribune de Pueblo, and our own flyers that we're taking door to door and putting in people's mailboxes and stuff, because, you know, first of all, poor people, they speak whatever their indigenous language is, and then two, you know, their internet shut off, or the only way that they had internet before was to like go sit outside McDonald's or Dunkin' Donuts. And so we think it's really important to get information to them, about what's going on and how they can get involved and those kinds of things. And the number one calls besides poor people that we're getting is from social workers who are just frustrated and don't know what to do. And they knew before the crisis, you know, this further crisis hit, that the resources really don't exist. And so they're joining the Underground Railroad and assisting us. So they're doing their, you know, 9 to 5, and then they're helping us with food distribution, or they're helping us with, you know, bringing a heater to housing takeover after they're over, you know, done with their job or whatever. So that's some of the mutual aid stuff we're doing. We're doing it in the largest amount of numbers. We're doing consultations with poor people's organizations, and different homeless unions have been calling us from different parts of the country, asking us how to deal with various different things. And we're putting them in a relationship with, you know, some of our generals across the country that have been doing this stuff for quite some time. So that's what I have to say about the mutual aid process. And, you know, we are just so thankful to have relationships with, you know, social workers that are about being freedom fighters and not, you know, instruments of social control. So that's my 2 cents.
Thank you, Sherry. Thank you for sharing what you're on the ground doing right now and what you've done for decades, as Jennifer's saying, keeps saying. No, but I think it's important to note that this is not a new thing that you are doing in this moment, that it's been happening. It's been, the need has always been there, and you all have always been doing the work. And so again, as we look to COVID, or look at COVID as a way to have this conversation, we have to realize this is not a new situation. This is only kind of like with Katrina, the wool is being kind of pulled off our eyes, or we're kind of seeing things in a new light. This is not new stuff. And so you've been there on the front lines doing that for a while. So thank you for that.
And I think this is, and Kalila and I were talking about this before, is that this, what Sherry and the Poor People's Army is doing is really this direct service work. So when we talk about in social work about direct service work and, you know, working directly with individuals who are in need, the Poor People's Army is doing that in a non-oppressive way, in a mutual respected way where there's a reciprocal relationship with folks. And sometimes that kind of flies in the face of social work, who has this clear code of ethics about, you know, strict boundaries between I'm the social worker and you are the client, and we do not, you know, we do not cross this line. But when you're doing the kind of work that we're this radical social work, there has to be this reciprocal relationship where we're both learning and teaching from each other. We're both giving and receiving in this relationship. And sometimes that feels kind of odd for folks who haven't done that type of social work. And so Sherry and the Poor People's Army are really doing that radical social work, direct service work to make sure people's needs are met. And really doing in this non-oppressive practice. And so it's a great example of thinking about what mutual aid looks like, because there's been a lot of conversation, like you Google, you know, 3 months ago, you would have Googled mutual aid, and the last thing that was written about mutual aid was years ago. But now you can Google mutual aid, and there's lots of articles talking about mutual aid and what all these groups are doing. And if you just get on a Google Doc and add what you need on a Google Doc, people are providing, and that's great, right? But just like Sherry was saying, is for folks who are broke, people often don't have internet, right? And so Sherry in Philly, where Sherry is in Kensington, there's a lot of folks that don't have internet. So I can't just log in and say, hey, I need, you know, formula for my child, right? You have to go where the folks are. You have to go door to door. You have to go and do, you know, mailings. You have to go to where people are. And so a lot of this mutual work takes a lot of hard work to do. And that kind of moves us into the next slide when we're talking about social workers and creating this change, right? Creating this radical imagination. I'm going to let you take the first bullet point. You're muted.
I'm trying not to let you hear the dogs, so I keep muting myself because they're going nuts over here. But yeah, I think that as we've talked about the different special populations that we've discussed today, we think about, okay, so we have an immediate need to address whatever they're experiencing in this moment, right? So if it's people need housing, we think about, okay, we need to get them in housing. So yes, let's find some empty hotels, put them in empty hotels, right? But again, there are policies that are in place that create a homeless situation, right? So we think about people that are incarcerated. We want them to get them out because yes, it's dangerous in there. It's a petri dish for this virus to spread and potentially kill people, right? But okay, let some people out. That should help, right? Yes, but there are policies in place that create systems that put people in prison, right? And so, so yes, we want to get people that immediate need, meet that immediate need, but also our responsibility is thinking about how do we create longer term change? How do we think about how do we dismantle those systems that put us here? I mean, the pandemic is giving us the tool or the topic, but these things have been happening. And so how do we not only do the immediate need stuff, but work towards dismantling these systems that put certain people at greater risk for dying or being harmed through this pandemic. And so that a radical imagination is we have to do both. Like, I know that we're often taught in school that the immediate need or fix this problem is we're taught mostly to deal with, and not so much around addressing and thinking about the policies that got us here in the first place, or what interest got us here in the first place, right? Because I know the things that we have going on in this country are not in my best interest. So whose interest are we used to working towards when we see our policies and procedures that we currently operate under? And so it's important that we think about connecting the day-to-day needs to larger systemic issues that we're experiencing in order to work towards both.
And so as Kalila was saying, it is this both and, right? It's addressing the immediate need and then working to dismantle the oppressive systems. And when we think about this next concept of freedom versus liberation, is sometimes when we think about freedom, freedom is often aimed at the individual level. I'm trying to gain freedom. It's about my own agency. Whereas with liberation, we're talking about liberation means we're reshaping these state structures. We're radically restructuring in order to gain liberation, and not liberation or freedom just for me, it's liberation for us all, right? That we may have to give up a little bit of something to gain liberation, right? That we have to put in the hard work of liberation, right? So that might mean that we are going to address the immediate needs of this person in front of me, of getting them house, getting them food, but then I'm going to do the hard work and continue that work above and beyond to fight these structures that are maintaining people in these oppressed and marginalized situations in the US. I'm going to keep doing the work to dismantle white supremacy and capitalism and all of the other isms as well, right? And so when we talk about freedom versus liberation, this liberation piece is really about this piece of us being both vulnerable, about putting ourselves out there, and also accountable, as Dara said, right? That we are accountable to the larger system. And in order for us to be liberated, for all of us to be liberated, that it really is about reshaping these structures for our liberation. And as social workers, that's where we need to be falling on, right? That it really is about addressing the needs, but dismantling these oppressive situations so that we all can be liberated in the end.
Yeah.
And so, actually, I'm gonna go here and then we'll come back. And this was, I'll let you take this last one because this was your favorite quote.
Yeah, so as we said earlier, another world is possible, right? And so we're seeing that happen. And so I wanted to share this quote to send us out of here to think about, you know, another world is not only possible, she is on her way. On a quiet day, I can hear her breathing. And like I said earlier, we are now seeing, like this is coming true for us. We're seeing that we can do things a different way. Like we actually, under a concerted effort, choose to do things. And I'm saying we as the larger country, we choose to do things the other way, but we can do things different. We're seeing that now. And so I hope that you all can hear her breathing too and are ready to take up the mantle to help her come to fruition. So that's all I have.
And so we want to thank you all for joining us today. I know that the Poor People's Economic Human Rights Campaign has been doing, and I'll let Sherry or Matt talk about it, but they've been doing, I think, a monthly meeting of radical social workers in Philly. And so I wanted just to leave a little bit of space if they wanted to talk about any announcements. And so we're going to unmute Sherry so she can jump in there.
Hello. Am I unmuted?
You are unmuted.
Okay, but I'm invisible. But never. Again, I just really want to thank Kalila and Jen, you know, my colleagues in the welfare recipient world and being broke mamas, to really being, you know, I think models of radical social work in this country. And every month, if people go to our website at economichumanrights.org, of the Poor People's Economic Human Rights Campaign, Matt will put up a link and some information. We have a monthly Breakfast of Champions, and we're actually checking in with each other now once every couple weeks. And more social workers are getting involved and, you know, actually learning from some of the poor folks that are on the front lines about what are some of the issues and developing relationships of working with each other on this new Underground Railroad. So, you know, like Kalila and Jen said, you know, there is a different way of doing things. I think we're seeing it now. And we just want to push this snowball down the hill so that it really blossoms and it grows. And we create the kind of world that all of us want to live in. So we have, you know, lots of books and movies and space so that social workers can cross-fertilize with each other. And that's it. We just want to thank everybody for, you know, tuning in and hearing from some of these pioneers, and want to encourage people to continue this relationship and make sure that you and your family stay healthy. And yes, even if you're social workers and you need some help, be sure and reach out, because we're here to take care of each other.
Thank you, Sherry.
Thank you. And so I know some folks are asking about getting access to the slides. We will, Matt said to follow on Facebook, but Matt, can they get the slides that way?
No, he also talked about, he also left the email up here.
Okay.
So if you would like the slides or the recording, you can send an email to ppehrcorg@gmail.com. He put that in the chat so you all can see that. But ppehrcorg@gmail.com. Email them.
Yeah, and we'll send out the slides. In the slides, there's lots of notes at the bottom with also a bunch of different links to articles and websites that are tracking some of this information. So there's lots of good information in the notes section as well. So, all right, well, thank you. I see you, Lisa.
Do you want to give them a few minutes for questions just in case they have some? Even I know we're over time, but
yeah, I mean, if people wanna hang out, I'm at home, so.
my life is full of nothing, so
Yeah.
this is my entertainment for the day. So
yeah, people want to have a little bit of conversation. Yeah.
So if folks have any questions, you can either raise your hand and we can let you open, we can unmute you, or you can type it in the chat and we can address it that way, or we can say bye.
Don't look so sad.
I'm here by myself, so.
Reverend Bruce has got something.
Yeah. All right, let's unmute Bruce.
Thanks, Mary.
Okay, just to say real quick, we're doing, and you can contact me at refugestpete@gmail.com. You'll see a Facebook page too, though it's going up. But next week, we're doing a Zoom chat around addicts and addiction in COVID-19. And we're going to have some licensed addictions counselors, including myself and my wife, as well as some recovering addicts, talk about coping with COVID-19 as an addict.
And where can we can get that on PPERC's Facebook, or where can we get that information?
It'll be posted on PPERC's Facebook page, but
okay.
also you can contact me at refuge, REFUGE, St. Pete, STPETE @gmail.com.
Okay. All right, that's good information. Yeah. Anybody else? Thanks, June. Really, June? I didn't know you did on the Poor People's Campaign. All right, yeah, so you can see Reverend Bruce's information's in the chat box too. There you go.
Me and Matt were texting at the same time.
Thanks, Joseph.
All
right, well, please join in then if you can with Reverend Bruce next week. And then we'll be getting this information shared out to you.
Yes. Thank you all for coming out today. Or for joining us today. I really appreciate it.
Good. Stay safe.